Hey everyone, welcome back to today's video. My name is Abby Evans and today we're going to be talking about what is a feeding tube. People can have feeding tubes for a variety of different reasons. It can be anything from cancer treatment to gastroparesis, nourishment, to little babies that have them when they're born because they can't swallow. Not everyone with a feeding tube is going to have the same reason for having the feeding tube, but it's really important to understand what feeding tubes do, why they're important, how they work, and what types there are. So in today's video, I'm going to cover what they all are, and I hope you enjoy it and find it all very helpful and educational. First things first, why do I have a feeding tube? I have a feeding tube because I have something called gastroparesis, which is secondary to my primary condition, Ehlers Danlos syndrome. Gastroparesis basically means paralyzation of the stomach. It's gastric, which is your stomach, paresis, which stands for paralysis. The main reason I have a feeding tube is because of the gastroparesis, and that means that if I eat anything orally, it tends to just stay in my stomach for a really long time. And I don't mean like a couple of hours, I mean like could be days. And so that means I can't eat a lot of things. I can eat little bits because sometimes they go through, but if I eat a lot of food, unfortunately, your stomach has to get rid of it somehow, and if it can't pass through into your intestines, it's going to come up the other way. What type of feeding tube do I have? I have what is called a PEJ J, which stands for percutaneous endoscopic gastrostomy jejunostomy. For me, that means I have one main tube that goes through my stomach and then a little tube that goes through that tube into my intestines. So I have access to both my stomach and my intestines. Now for me, my feeding tube is really important. It is basically 90% of my nutrition that I get. Without it, I would not be here on this planet today. I've had a feeding tube for 4 years and I've had 3 different types, and I'm going to explain all the different types of feeding tubes to you now. What types of feeding tubes are there? 4 main types of feeding tubes. We've got the NG. Now these are the ones commonly seen in people with swallowing issues. So these tubes go up the nose into the stomach, and that means that you have a liquid feed that goes through the nose, down the esophagus and into the stomach, and it bypasses the whole swallowing mechanism. The next type is also a nasal tube, a nasal jejunal tube, and this is the type of tube that goes up your nose into your stomach, but it doesn't stop there. It carries on and it goes right down into your intestines. So this is a really long tube, and this is good for people like me who have gastroparesis, and I've had this tube. The advantages of getting fed into your intestines are that if you have a really slow moving stomach, you probably have an issue with absorbing feed. So by sending it straight to your intestines, it gets absorbed quicker and more nutrients get absorbed. The next major type is a PEG. It's also known as a G tube. Either stands for a gastrostomy tube or a percutaneous endoscopic gastrostomy tube. They're both very similar. One's placed by endoscopy and one's placed surgically. This tube goes directly through the stomach wall, the same as an NG, but just goes directly into the stomach instead of through the nose. The advantage of having it not through the nose and directly through the stomach wall is obviously you don't have something on your face all the time. It's a bit more comfortable, but also there's a disadvantage in terms of there's a higher infection risk. And then the final type of tube is called a jejunostomy or a J tube. This type of tube often requires major surgery, so it goes straight to your intestine. Now the advantage of this is that there is no chance of it moving. Once it's in, it's in. They are the main 4 types. There are other types, like the one I've got a PEG tube with something that's called a jejunal extension. So I have a PEG tubing, then through that PEG tube I have a little thinner tube that goes through my stomach, out of my stomach, and into my intestines. The advantage of this is that I have access to both my stomach and my intestines. So I think it's probably time I show you my feeding tube. So you can either be pump fed, which is the case with most jejunal feeding because you can't have a lot of liquid going into jejunal at once, it needs to go slowly. But with gastrostomy feeding or feeding into the stomach, actually you have something called bolus feeding, which is feeding that you do maybe every 3-4 hours, and you give a couple hundred mils each 3-4 hours, so it's more like eating a meal. And this is fine for people without stomach motility issues. If you have a slow moving stomach, like me, you can't do that. That's all there really is to know about feeding tubes. I hope this video is really helpful, and if you have any questions, leave them below. Let me know what other videos you want to see. Thanks for watching. Goodbye.